Oncology.TV at ONS 2010, and we are delighted to have with us Susan Leigh, who is an oncology nurse and also a cancer survivor herself. Congratulations on both counts.
Thank you.
How do they play together?
38 years ago, I was diagnosed with Hodgkin's disease. That was in 1972, right before really the specialty of oncology. It was just emerging at that time. So when I got through that initial therapy and realized there were no resources for us, no support for us, no one to ask any questions about, we were just really transitioning to a whole new area of cancer care. And so I eventually went into oncology nursing, feeling that I could bring some experiential expertise to this emerging field of oncology.
How do you incorporate advocacy into clinical practice?
I think nurses probably are the very best advocates that cancer patients have. So what we from the advocacy community do is really try to educate the oncology nurse to the importance of advocacy and to being the advocate for the patient. They already do it anyway, but what we would like to do is give them extra tools. So many of us have been working for years, over the last 3 decades, really developing tools for nurses, for social workers, for physicians, to really help the individual who's first diagnosed with cancer get on their way and get on their way as well as they possibly can. So an example is with the National Coalition for Cancer Survivorship, which I'm real involved in, we developed the Cancer Survival Toolbox. We said when you're first diagnosed with cancer, you have to learn a new language. You have to make decisions at one of the most vulnerable times of your life. You don't know any of this stuff. You don't know how to navigate this entire system. Of course, navigation is a really hot topic now. So we developed a program of CDs that really help build skills for people to get through this really difficult time. And then we've developed a number of special topics after that. An area that I'm particularly interested in is the transition time when you complete your initial course of treatment and transition to post-treatment, which is a really, really scary time for most cancer survivors. And in the past, our hope was, we've given you curative therapy, we hope you're going to be fine. But there was nothing to help people in that post-treatment phase. So many of us are working to really expand the continuum of care so that we help patients when they're first diagnosed, we help them, support them through their experience, and now we've got to continue to support them after their experience, which is a really, really difficult time. And it's the success story of oncology is that we now have long-term survivors who we have to care for.
And you're one of them.
And I'm one of them, yeah.
What resources are there for advocacy, and how does one find them and use them?
There is so much out there now for the individual survivor and their family, for the oncology, nursing profession, whoever. There are so many resources available. And I think one of the major problems is how do you help people find the right resources and really legitimate resources, because there's also a lot of crap out there that you really don't want people getting involved with. But that's why someplace like this, coming to ONS, is so critical for oncology nursing, because they can go to the advocacy booths. So many advocacy organizations are actually represented here, and they have really good, legitimate resources that nurses can then pick up. They can tap into websites. They can find printed materials. They can now have access to something like this, which is so brand new. So if the oncology nurses can start identifying and partnering with the organizations and programs that they find here, that's a great way to start. But then get those resources into their clinics, into their hospitals, develop resource libraries, help put together support groups, get the journals and the cure magazines into the patient waiting rooms, so that people know there are good, legitimate places for them to go to find this information. And our CDs are available for the Cancer Survival Toolbox. They're available free. Most of this is free, but we just have to get that into our clinical practices so that we have access to all of this information.
Susan Leigh, thanks for sharing your knowledge as both a survivor and an oncology nurse.
It's been my pleasure. Thank you very much.
My pleasure to call you my neighbor in Arizona, too.
Yes.
Okay. Susan Leigh joining us from ONS 2010 here on OncoView.TV.